Well, hey guys, I was teasing you there. I had the little yellow slip over the camera so I can get everything all set up. And we were able to do that because David is not here. He decided to um, take a vacation, and therefore I have to do everything. But anyway, welcome. I'm Dr. Jerry Cartznell, and I'm a board certified pediatrician, and we are going to be talking about the impact of the COVID virus lockdown all over the United States, all over the world in many places, some places not, and its impact on our children. And this was suggested to me by my lovely wife Donna, who basically said that we need to talk about how this is affecting our kids and maybe what we can do to help that get better. So, without further ado, let's talk about the health issues with the children. And this is where I'm getting quite irritated with because of the fact that, for example, I have a patient in South Carolina who's got a whopping cavity and an abscessed tooth sitting on top of a moving wisdom tooth. And it's causing him a lot of pain for months now. And they finally opened up the operating room for him to have his dental surgery, except he must have the COVID-19 test before he can get admitted. He's a big boy, he's over 6 feet tall, and he doesn't want a 16-inch Q-tip shoved up his nose to the back of his throat. In fact, he's going to toss people there. But it's the hospital board of directors' decision that no one, under any circumstances or any kind of handicap, can enter without this kind of testing done. And so therefore he is chronically suffering because of his decisions and because of the decisions of the hospital board. So our health issues are having a problem. I was reading one today about a patient of mine who needs an eye exam because mom's really worried about the eyesight changing. And of course, we can't get in without a COVID-19 test to have an ophthalmologist take a look at the eyes. So I know that the health issues are huge. I have a young child now who's being treated by a gastroenterologist who hasn't had the opportunity to do endoscopy and colonoscopy, but is just presuming that we have inflammatory bowel disease, and I think that's a good presumption too in this case, without biopsies, and we've already initiated treatment for that. So he's getting treated with some very powerful medications, but we don't have the gold standard testing that we'd love to have and feel a little bit more reassured that we're treating the right thing. So our health issues go on and on. The kids are not being seen, and that's very difficult for our kids. The mask issue, and many of you know this already, I'm just going to be preaching to the choir, is very difficult for these kids to wear masks. Some of the kids are fine with it. Some of the kids, like my son initially would be below the nose, and now he's doing better because my wife got the pointed mask that you get at Target that fits really well, and it's pretty comfortable and easy to breathe through. But the mask issues are huge. The isolation is another big problem for our kids on the spectrum. They are used to routines. They don't like uncertainty. They don't like restrictions. So the kids who are used to going out on hikes, walks, rides, parks, all of that, going to the swimming pool at the complex or the park pool or whatever, that's all been curtailed. And down in Florida, we can swim 10 months a year, but in most places around the country, you got a very narrow window that you can be outside and playing. And the kids are really having a problem. They love their routines. Many of them thrive on routines. And as great as our parents are, not everyone is set up to be an ABA therapist with the routine and the schedule and everything. It's very difficult to follow. And thus the kids are having a problem. And if we're doing we shouldn't play on the iPad, we shouldn't be doing the iPhone because it's really destructive for them, we shouldn't be watching TV, then the parents are reduced to basically being camp counselors and saying, from 9 to 10 we'll have trampoline, and from 10 to 11 we'll do arts and crafts, and from 11 to 12. And we can't keep that up. We can't sustain that. There are some gifted parents who are marvelous at doing that, but a lot of us, that's really challenging to do. And day in and okay, so we can do it for a week. We can do it for 2 weeks. But month after month, this is getting exhausted. Getting exhausted. Um, so now that we've got this Zoom protocol where we can do our therapies or even our school with Zoom, there are a few kids, and I just was speaking to one, who do great with that. They love it. They love it. But for the majority of our kids, they can't make that connection. Yes, they love the computer and they love playing games, but when there's a therapist, whether it be speech or OT or whatever, they can't make the connection, and it's brutal for them to sit there for an hour and a half, 2 hours, let alone the whole school thing. And that's the whole issue that we have to remind ourselves about autism. This is a spectrum disorder. I don't have to remind you guys about that. Some kids are very high functioning or even in the moderate range, but do well in certain situations and do very poorly in others. So they can't come out with oh, this is how we have our autism program. This is what we're doing. It's like autism program is supposed to be tailored for each child. It's called an individual education program, an IEP, because each one of these children is so unique and different. You can't throw a one-size-fits-all Zoom meeting. Now, I understand they're doing the best they can, but on the other hand, I also understand from the parents that I get to talk to every day, this is really, really hard, okay? And I don't know if it's actually doing anything. In other words, we feel like we're going through the motion, but we're not making any progress with the child, and that's the challenge right there. So the taking away the kids' ability to go and experience things is difficult, especially if they won't wear masks. And now in some places it's no mask, no admittance, and that's really really difficult for our boys and girls. So we have to keep that in mind. The therapies that we're missing is actually causing some regression in some of the children I'm treating because we've stopped them. And like I said, the Zoom therapist speech, great try, and for some kids it's amazing, but for the majority of my kids it's a swing and a miss. It's just not working. Occupational therapy or feeding therapy, how can you do that through Zoom? It just boggles the mind. Again, I understand they're doing the best they can with what they have, and God bless them for trying. But what it actually translates into a meaningful hour or two with our kids, reality speaks here, okay? I mean, it's just not helping. So the kids are stressed out. The parents are now getting stressed out. In fact, I was just before I turned you guys on, I was just talking to a mom, and we're having more epileptic events, and mom's running on fumes. There's a lot of things going on in our households beside our kids, whether it be loss of paycheck or two, losing one's home for whatever reason. We just had some neighbors have to leave because they didn't have the income needed to maintain the house that they were in. This is all very stressful, and I'm worried about that. I was reading yesterday, calls to the suicide centers are up 600%. Okay, these are folks that are really struggling. You throw a special needs child in there, a single earner household where there's only a single parent in there, not having a place for the kids to go. And remember, we're talking about one or two special needs kids per household. What about the rest of the kids, too? So a lot of our parents are running on fumes, and it's easy to say, well, they should reach out and get some help. The people who are doing the helping, they're full, they're inundated. There's only so many hours per day, and there's only so much energy a provider has to hear the issues that are going on in each family, and then being able to come up with meaningful protocols that help our families. We're going to talk about some of this in a minute. The other thing, too, that really annoys me is the consideration of what is essential or not essential. And by making our our therapists and then our interventionalists, non-essential workers. Uh, hey, when you've got a special needs kid, these people are essential and they're not able to come. Things are opening up now in certain parts of the country, and the parents are getting the help they need. Other places are restricting the flow of interpersonal relationships with these folks, and it's limiting it to Zoom. And if you're in that area, you know who you are, and that's just becoming a travesty for family support, mom and dad support, the caretakers. Maybe it's grandma who's watching the kids, who will watch the children, but they've got people coming in 2 or 3 times a day to help her out so she can have a break, go use the bathroom by herself or whatever. So that's where we're at. Okay, so what do we do about all of this stuff? Obviously, there's not much I can do about the therapies. I was actually scanning earlier today about looking online what people are saying to do to make your lives better. Um, Create a calm environment for your house. Who comes up with this? It's like, okay, so we intentionally have an uncalm environment and now we're going to change it. Turn off all of your screen time for the kids. Oh, great. Now I have absolutely no time to myself to do anything, let alone prepare a peanut butter and jelly sandwich for the other kids. What I find is that these are well-meaning and probably good good ideas, but they don't translate into help. All right. From an isolation point of view, I think you do need to establish play dates again, or going out and doing things, even if it's going to a butterfly farm or taking a walk or a hike. Fortunately, in most parts of the country, the weather's nice and you can go outside. I hope this doesn't continue into the dead of winter. But it's really important for the kids to get outside and go do stuff. Even if it's walking a mall before they open, or just getting out into nature, getting some sunshine, going, for those folks who are fortunate to live near a beach, going out to the beach and walking around. And I think that's really crucial, because it's very easy for us to get into a rut and say, I'm just not going anywhere. Or the only time I get to go out is when someone comes over and I go grocery shopping with a mask on. So the getting out is going to be your biggest thing. Obviously, all the museums and the hands-on stuff are out, and we can't use those because it's silly to go to a children's museum and not be able to touch anything. But that's kind of what they have. For us personally, getting out is the best thing that we can do. And the next thing, fortunately for many folks, is having access to a pool. If you don't have access to a pool and your child likes the water, it is really a stabilizing force, that water. And so I would find, beg, borrow, steal somebody that you can go in their backyard and use their pool. Some of the kids can stay in pools. I would probably say 2/3 of the kids that I take care of, the pool is a great grounding area. They just can go in there for a couple of hours. They're in the pool. I had one today. They're kind of like my son was when running. The kid will swim laps, and he will swim laps. He doesn't tire out. My son used to run laps, and I used to say, "You got to stop him. His heart's going to explode." But these kids really, really love the water. If you don't have access to a pool, then getting the old-fashioned water wiggle out, and hooking up to a hose and having water time, having them run out and around the backyard. Kids always do better with exercise. Some of the families, the kids will ride bikes, they'll ride scooters. We just have to get out and do it. So the best thing that I have seen for our children is exercise. Bottom line, exercise. Getting out, doing something, and moving and tiring them out. In fact, that's a lot of my family's most evil genius plan, is to get them so tired that when nighttime comes, they're ready to go to sleep. They are exhausted. All right. So that's a very important thing to do. If we can, in certain areas, reestablish our therapists coming over. A lot of our therapists now are coming in different parts of the country, are able to come in and actually get going with the therapies. And they do their temperature thing, and they come in with their booties and their face masks. But a lot of places are allowing them to take their face masks off one-on-one. So if you can get 1 or 2 therapy things going per day, that would be super. Okay, so let me see what's going on here. Um, let's see, nothing shows up for me. I think I'm on. Um, yeah, I think I'm doing good here. I think my wife said all's good. Yep, yep. Okay. So if you have any questions about what we're doing, there's a lot of question about people who are worried about the COVID-19 and their children. And if your child has a normal immune system, then there's probably very, 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 very small chance that COVID-19 is going to have a bad outcome in your child. The numbers I heard yesterday was like 1/5 of 1% of children are going to have a hard time with COVID-19. Now, this is for kids who have an intact immune system. A lot of the families that I take care of, their immune systems are not intact, so we have to be a little bit more careful. Of all the children that I have the honor of taking care of throughout the world, including Italy and all, I've only had one child have a presumptive COVID-19 positive, and I think it was true because mom was COVID-19 positive. She had the upper respiratory infection for a week and a half, 2 weeks, and the child had one for a week. They didn't need treatment other than symptomatic, like you would do with any upper respiratory tract infection. But I've had one, and I'll call it positive because mom was positive and their symptoms were very similar. On the other hand, a lot of people are getting called positive and maybe the testing wasn't accurate, you know, but I wouldn't worry about it. Now, if I have a child who is immunocompromised, um, then I'd be very careful with them and make sure that they're taking vitamin D and zinc, vitamin A, okay, and a good multivitamin, and I think we're going to be just fine. I had a question last week about would I treat a child with COVID-19? No and yes. No, if it was like the child I just described to you, where they are asymptomatic or they've got upper respiratory tract infections. Would treatment include vitamin D, vitamin C, and zinc? Yeah. But I think they were asking more specifically about the whole hydroxychloroquine and azithromycin and zinc. Well, I use the azithromycin quite routinely in my clinic, along with zinc, by the way, for many of my patients where we think they've got a PANDAS or a PANS kind of problem going on. And so using azithromycin and zinc together is a no-brainer here in our clinic. Zinc also helps the taste buds for our kids who don't want to eat protein because protein tastes terrible when your zinc is low. So there's a lot of good reasons to use zinc. Hydroxychloroquine or chloroquine I've used in the past for children who are going to regions where malaria is epidemic. In many of those regions, hydroxychloroquine is sold over the counter like Claritin and Zyrtec. Remember, Claritin and Zyrtec came out as prescription drugs originally, and then they moved into the non-prescriptive class, just like all of your acid blockers like Pepcid, Prevacid, and all those were all prescription drugs at one time. So hopefully at some point maybe this hydroxychloroquine will be a non-prescriptive drug. But right now it's still a prescription. If I had a child who was having significant problems and not quite ready for the hospital, would I consider hydroxychloroquine? In my state, I can't. In some states, you can't. And I would consider that based on studies done in 2005 through the NIH, through a publication called Virology that looked at chloroquine, and it's basically its bigger brother is hydroxychloroquine, and the SARS virus that was big back then, and it was very effective. So we've actually done studies that are 15 years old showing that that's positive, and I think that would be something that we could certainly consider. Is it off-label use? It is off-label use. And the problem with off-label use in pediatrics is everything, 90% of what we use is off-label. The American Academy of Pediatrics did a policy statement, 2002, 2005, that basically says that, um, here I'll read the description. As such, the term off-label does not imply any improper, illegal, contraindicated, or investigational use. Therapeutic decision making must always rely on the best available evidence and a knowledgeable physician. So, on label, off label just basically describes what the drug company manufacturing the product can advertise that it does. But it does other things, but they haven't done the double-blind placebo multi-center trial, which is the gold standard. So until that they can prove to the FDA with at least two major studies that it grows hair or whatever they're saying, they can't say it. But if I know something grows hair and I want to use it, I can, off-label. I'm just picking something. Minoxidil came out as a heart medicine, but they noticed that the men they put on minoxidil grew hair, and they said, hey, we can make more money as a hair tonic if we cut the dose in a tenth. And so they took it off for the heart because it wasn't a great heart drug, and they made a fortune with something that grows hair. So, but anyway, we have to be careful that when people say, oh, that's off-label use, it hasn't been proven or whatever, being gluten-free, dairy-free, we haven't had a double-blind placebo-controlled study, but we know as physicians, you know as parents, that it works. So the doctors out on the front lines who are treating our patients with COVID-19, they get a good feel for what works or not, and they're very vocal about it. And there's just some pressure there, but I want you to know that that is an option, but I don't want you to worry necessarily about what happens if my child gets COVID-19. By and large, neurotypical children, children with intact immune systems, if they get COVID-19, that's the safest group of people to get it. They're just not going to have a bad outcome. Does that mean all children? No, there's never a universal. There's never a universal. All children will be fine. There's always going to be somebody who's not going to do well with a particular biological intervention or a disease, whether it be chickenpox or rotavirus or whatever. There's always a risk to life. There's always a risk to life. We can try to minimize it, but then we have to start asking the question, when do the minimizing the risks actually cause more problems? Something for everybody to think about. Okay, so let's see, are there any questions here? Oh, you're getting into the frontline workers can't even speak up. Right now, it's very difficult to get good medical information, even for me, trying to wade through studies that are false or studies that are good. It's a very interesting time about trying to get good information on what you should do with autism. If you were to Google what should I do with autism, you'll have so many different groups telling you what you should do, and it's like, how do I do all this, or what don't I do, or should I just ignore it all, or should I embrace everything? And it's tough. It's tough for me, so I can't imagine being a parent who's not trained in the medical sciences to be able to get through all this, especially now with COVID-19. We hear so much how many cases we're having each and every day, and it's kind of scary. But from my point of view as a doctor, I want to know, well, what's happening with those cases? Do we have 1,000 new cases that are pretty much asymptomatic? Or do we have 1,000 new cases that are on ventilators? I mean, there's a difference there, but we're not getting that information. So you're absolutely right, Jess, when you talk about that. Let's see. Jessica says, we have a state mandate, but our ABA agency isn't requiring kids to wear them unless parents request it. Okay, so we're talking about masks and all. So my wife says I need to refresh my screen, so I will refresh my screen, so I might get some new, let's see, I might get some new questions here. And home. And there we go. All right, so I refreshed my screen, and let's see if I've got any more questions coming up. And I think that's it. Okay, great. So if you have any questions, you can go ahead and write me. I'm actually getting them right now. Bottom line is that when I look at autism or I look at upper respiratory tract infections or whatever I'm looking at, I'm always going to ask the question, so what can I do to make this better? If you have an upper respiratory tract infection, are you wheezing? Do I want to give you a breathing treatment or whatever? In these particular cases, I like the idea of prevention first. You know, that ounce of prevention is worth a pound of cure. And again, for everybody who's new to listening to me, to make our immune systems healthy for anything, we need vitamin D. Okay, vitamin A helps the mucous membranes. We have to monitor these. As a physician, I can put a child on them, but I'm going to watch the levels so we don't get toxic. Vitamin C and zinc, those are like the four best core things you can do, all of us do, to ensure that we give our body every advantage not to get an illness, and later on when they're back in school, colds and coughs and regular stuff. And if we do get an illness, it's minimal. When do we start thinking about the things that other people are saying that treat the COVID-19? Well, that's when our kid is getting real sick and not quite ready to be admitted or whatever. Then we may want to consider working with our doctor to see are there any advantages to trying a new treatment protocol that is pretty darn safe. Azithromycin, for example, with hydroxychloroquine. That's what's out there. That's what I'm being asked. Okay, so I think that's all I have to say here. Do I think kids should be on zinc right now? I do. I put all the kids on zinc, and how much, it just depends on the age and weight. For my little peanuts, they're going to be on 10 milligrams a day for kids who are, under 2. For kids from 2 to 4, I'll have 20 milligrams per day. 4 and older, I may be up to 30 or even 40 milligrams per day as they get a bit bigger. So, but they are going to be put on zinc. Just about all the kids I take care of are on zinc anyway for other reasons, because it's really, really good. Right, vitamin D. What about vitamin D levels? So again, for children between 1 and 2, 1,000 IUs a day of vitamin D3. Okay, from 2 to 5, I'll put on 2,000 IUs a day. Older than that, I'll keep them on 2,000, but I can go up on it if I have levels, because you want to keep the levels around 80, 70, 80, even 60. You certainly don't want 17 or 10 on most of the scales that we use in the United States. Okay, I think that is all the questions, and that's pretty much all the time we have for you today. If you have any questions during the week, go ahead and email us, and we will put them down and answer them the following week. So you guys have a great week. Stay well, stay healthy. I hope this helped clear up a little bit about what we do here in our office. Have a great afternoon and great rest of your day. Bye-bye now.